Hello, Mrs. Smith. Hello there. Let me just check your name. All right, Anna Smith, lovely. My name is Staff Nurse Culligan. You can call me Fiona if you like. I know you've been here for about a couple of hours now, and you've got a lot of pain in your tummy, and you've been vomiting a lot. So what we could do, if you wish, we could try and put down a tube. It would go in through your nose, down the back of your throat, and just sit in your tummy, and then whatever vomit is down there, whatever is down there, will drain out into a bag that we could put at the end, and that would make you feel a little bit more comfortable and maybe a little less retching. You still may feel nauseated, but we can give you something for that. How does that sound? It is uncomfortable. It shouldn't be painful. It doesn't take too long. One of the things that can go wrong is that the tube, instead of going down into your tummy, can go down into your lungs, and that may make you cough and heave a little bit. But if that's the case, we would just withdraw the tube and try again. And if it were to become too uncomfortable, too unbearable, then you can just raise your hand, let us know, and we'll stop the procedure. Is that okay? Right. Okay then, Mrs. Smith. I'll go away and collect the stuff, and I'll be back in a jiffy. And I can see that you're in the right position there. You're sitting upright, so that's the easiest position to be in. Thanks a lot. Hello, Mrs. Smith. I'm back again. Before we start, just wanted to check your nose and nostrils. Have you had any surgery? Any problems with the inside of your nose? No? Okay. Do you want to give it a good blow for me, just to begin with? Just to make sure it's clear. That makes it a little easier. Okay, thank you. That's lovely. And what I'd also like you to do is just a glass of water, just so I can see that you can swallow properly, because when I put it down at a certain point, I want you to take some sips of water, and that helps the tube go down. Okay, lovely. Yeah, I saw you actually drinking earlier. There's no problems with that, is there? No. Lovely, thank you. Right, Mrs. Smith, did we decide on a nostril? This one here, the right one? Okay, that's lovely. What I'm going to do first is just measure it to make sure we reach your stomach. So if I can just put this against you there, so just from your nose to your ear, hold it there, and we'll pull it down, and I just have to find the bottom of your breastbone there. Yeah, I can feel it there. That's lovely. Great. I'll just mark that, and I'll be back in a moment. There we go. And you've just got your glass of water to the side there, Mrs. Smith, so if you can take a drink when I ask you to, that would be lovely. Okay, so we'll just go in through this nostril, slightly uncomfortable. That's right. Okay, lovely. Yeah, you feel it at the back of your throat. Can you just open your mouth for me? Let me see if it's coiling up there. No, that's lovely. Now, if you want to take that drink of water, that's lovely. That will help as it just passes through the back, and we'll just keep turning and pushing it on. That's right. Can you move your head forward for me, please? I'll give you a hand. That will just make it slightly easier to insert. There we go. And we've just about reached our mark. So can you hold it there for me? That's lovely. And I'm just going to get my syringe there and just draw some out. That's great. Just leave that there for a moment, and I'm going to take my tape. You can see the mark there, so we're going to just put that across your nose, wrap that round there. That will just do for there. That's it. And I've got a drainage bag here, Mrs. Smith, so we'll take this off for a moment. Put that on there. That's it. And what you'll see is, any vomit, any liquid in your stomach will just drain into that bag there. So hopefully you will feel less like retching, and we'll come back and give you something for that feeling of nausea. Okay, there, that's lovely. Take that. Right, so we have our aspirate and our sticks, so we're just going to pour some on, and we can see that that is 3.5, and therefore it is safe to use the nasogastric tube. Yeah. Right, Mrs. Smith, that tube seems to be in the correct place. We've tested what's coming out, so that's good. You should hopefully begin to feel a little less like retching, and if you're still feeling nauseated, we can give you some medicine for that. And what we'll do periodically is just come back and just draw out some of that fluid to make sure the tube is still in the right place. And I've left you some tissues there, just if your nose gets a little bit sore around there, you can give it a blow. If you're at all concerned that the tube may have slipped, then let us know and we'll come and take a look at it. Okay? Right, we'll see you later.